The back pain that's actually your dying pancreas. You know that nagging, persistent back pain you've been dealing with? The one you blame on your crappy office chair, that heavy gym session, or sleeping wrong on the couch? What if I told you that your spine might be completely innocent this time? What if that pain is actually a desperate cry for help from a vital organ hidden deep in your belly that's slowly dying? Here's the scary part. Thousands of people spend months, even years, treating the wrong pain while the real problem gets worse and worse. Today, we're going to uncover how back pain can be the main warning sign that your pancreas is in serious trouble, and what you need to know so you don't ignore this dangerous red flag. But before we dive in, I want to know, where are you watching from? Drop a comment right now telling me what city or state you're in. I love connecting with viewers from all over. And stick around because I'm going to reveal the one simple test that could save your life. Something most people have never heard of. 1. The problem. The back pain. Everyone knows. Let's be real for a second. Who hasn't dealt with back pain? It's like a rite of passage for anyone over 30. You come home after a long day, plop down on the couch, and bam, there it is. That familiar ache in your lower back or that tight knot between your shoulder blades. And what's the first thing we do? We start playing the blame game. I need a better mattress. This work chair is killing me. I definitely overdid it at CrossFit yesterday. Sound familiar? Here's the thing. Most of the time, we're absolutely right. Good old-fashioned muscle and bone pain is by far the most common culprit. It's the kind of pain that makes sense. You overdo it, it hurts. You rest, it gets better. Pop an Advil, stretch it out, maybe get a massage, and you're good to go. But here's where it gets dangerous. We get so used to having back pain that we throw everything into the same bucket without asking the important questions. We ignore the details. Exactly where it hurts, how intense it is, and most importantly, what other signals our body might be sending along with it. And that's exactly how Sarah from Michigan missed the warning signs for 2 whole years. More on her story in just a minute. It's in this moment of assumption that something much more serious can be growing unnoticed. The question is, do you know how to tell? We ignore the details. Exactly where it hurts, how intense it is, and most importantly, what other signals our body might be sending along with it. And that's exactly how Sarah from Michigan missed the warning signs for 2 whole years. More on her story in just a minute. It's in this moment of assumption that something much more serious can be growing unnoticed. The question is, do you know how to tell deep in your abdomen, hiding behind your stomach, and because of this sneaky location, when it gets inflamed or diseased, the pain it causes often masquerades as back pain. Let me tell you about Tom, a 52-year-old construction worker from Texas. For months, he thought his back pain was just part of the job. He tried everything: new work boots, a back brace, physical therapy. The pain kept getting worse. It wasn't until he started losing weight and his skin turned yellow that doctors discovered his pancreas was seriously damaged. By then, he needed emergency surgery. This is where knowing the difference becomes literally life or death. Pancreatic pain is a whole different beast. It's not like a pulled muscle. People describe it as a deep, piercing pain that feels like it's boring right through you. It starts in your upper belly and wraps around to your back like a tight band. Picture a vice grip squeezing you from the inside out. But here's the critical part, and pay close attention because this could save your life. This pain typically gets way worse after eating, especially fatty foods. It also gets worse when you lie flat on your back because that position puts pressure on the inflamed organ. Many people find slight relief when they lean forward. According to a study published in the American Journal of Gastroenterology, up to 80% of patients with acute pancreatitis experience this characteristic boring back pain that doesn't respond to typical pain medications. This isn't pain that goes away when you change positions or get a back rub. This is pain that sticks around for hours, or even days. It's the kind of pain that wakes you up at 3 a.m. in a cold sweat. The confusion is so common that many patients end up seeing orthopedic doctors first, convinced their spine is the problem. They get X-rays and MRIs that show nothing unusual, and this dangerously delays the right diagnosis. If this video is already making you think twice about your back pain, smash that like button so this information can reach more people who need it. But wait, there's more. Your pancreas doesn't just send pain signals when it's in trouble. In the next section, I'll reveal the other warning signs that paint a crystal clear picture of what's really going on. 3. The red flags, warning signs that come along for the ride. A sick pancreas rarely just sends pain signals. It broadcasts a whole array of warning signs that, when added to back pain, paint a clear picture that something serious is happening. First major red flag, nausea and vomiting. When your pancreas is inflamed, it throws your entire digestive system into chaos. Food doesn't get broken down properly, and your body responds with persistent nausea that often leads to vomiting, especially after meals. Jennifer from Florida described it perfectly. It wasn't just feeling sick to my stomach, it was like my body was rejecting food entirely. I'd take one bite of my favorite pizza and immediately feel like I was going to throw up. Second red flag, and this might be TMI, but it's crucial, changes in your bowel movements. When your pancreas isn't working right, it stops producing the enzymes that digest fat. That undigested fat has to go somewhere, and it goes out in your stool. Your poop might become pale, greyish, bulky, and have an unusually strong, foul smell. It might look greasy or oily and can even float in the toilet bowl. If you see actual oil droplets in the water, that's a classic sign. Clinical studies show that steatorrhea, fatty stools, occurs in over 90% of patients with chronic pancreatitis. Third warning sign. Unexplained weight loss. If your body can't absorb nutrients and fat from food, you're naturally going to start losing weight without dieting or exercising. This weight loss can be rapid and comes with weakness and fatigue that doesn't go away. Fourth and most alarming, jaundice. If your skin and the whites of your eyes start turning yellow, this is a medical emergency. This happens when a swollen pancreas or a tumor blocks the bile duct, causing a substance called bilirubin to build up in your blood. Your urine might also turn dark, like the color of iced tea or Coca-Cola. Remember that life-saving test I mentioned earlier? We're getting to it right after I explain what's actually happening inside your body. Other symptoms that might appear include fever, abdominal swelling, and rapid heartbeat, all signs that there's active inflammation in your body. 4. Understanding the hidden enemy. What goes wrong? To understand how serious this is, you need to know what your pancreas actually does. Think of it as a superhero with two critical missions. First, it produces hormones like insulin that control blood sugar. Second, it makes pancreatic juice, a powerful cocktail of enzymes that help break down food in your intestines. Problems start when this delicate system fails. The two main diseases we're dealing with are pancreatitis and pancreatic cancer. Pancreatitis is inflammation of the pancreas. It can be acute, sudden, or chronic, long-term. In acute pancreatitis, inflammation happens fast and hard. The most common causes are gallstones that escape and block the pancreatic duct, or excessive alcohol consumption. According to the National Institute of Health, about 275,000 Americans are hospitalized for acute pancreatitis each year, with mortality rates ranging from 5 to 10% in severe cases. When the duct gets blocked, those powerful digestive enzymes get trapped. Instead of digesting food, they start attacking and literally digesting the pancreas itself. Imagine your stomach acid eating through your own stomach. That's essentially what happens. Chronic pancreatitis is long-term inflammation, often caused by repeated acute episodes or chronic alcoholism. Over time, this inflammation destroys the pancreas, creating scar tissue and causing it to lose function. This leads to chronic maldigestion and, eventually, diabetes as the insulin-producing cells get destroyed. Now here's that life-saving test I promised you. Pancreatic cancer is the condition everyone fears most. It's one of the most aggressive and hardest to detect cancers precisely because early symptoms like back pain and weight loss are vague and easily mistaken for other conditions. Pancreatic cancer has a 5-year survival rate of only 11%, making early detection absolutely critical. 5. The life-saving test and what causes this. Here's that test I promised. If you're experiencing the symptoms we've discussed, ask your doctor about checking your lipase and amylase levels. These are enzymes produced by your pancreas, and when levels are elevated in your blood, typically 3 times higher than normal, it's a strong indicator of pancreatitis. A lipase level above 300 UL, normal is 10-140, combined with characteristic pain, is diagnostic for acute pancreatitis in most cases. But knowing the causes is your first line of defense. Understanding why the pancreas gets sick helps you prevent it. The big 2 culprits, gallstones. Those little stones that form in your gallbladder can escape and block the same duct your pancreas uses to release its enzymes. When one gets stuck, it acts like a cork, causing enzymes to back up and create inflammation. Alcohol abuse. Alcohol is toxic to pancreatic cells and is the leading cause of chronic pancreatitis. Heavy, frequent drinking can cause irreversible damage. Other causes include very high triglyceride levels, fat in the blood, certain medications, smoking. Doubles your risk. Family history, autoimmune diseases, infections, abdominal trauma. The good news? Prevention often comes down to lifestyle, maintaining a healthy diet to prevent gallstones and high triglycerides, moderating or eliminating alcohol, and not smoking. Don't miss more life-saving content like this. Hit that subscribe button and ring the notification bell so you never miss an upload that could protect your health. 6. The solution. Knowledge is power and health. All right, with all this information, what do you actually do? The solution is knowing how to differentiate the signs and when to take action. Let's recap the key points to distinguish normal back pain from pancreatic pain, location and quality, muscle pain, usually localized to the lower back or between shoulder. Blades pancreatic pain starts in upper abdomen and radiates in a band to the back. What makes it better or worse? Muscle pain, worse with movement, better with rest. Pancreatic pain, worse after eating, especially fatty foods, and lying flat, slightly better, leaning forward. Accompanying symptoms. Muscle pain usually comes alone. Pancreatic pain comes with nausea, vomiting, weight loss, fatty, stools, and potentially jaundice. Remember Tom from Texas? He wishes he'd known these differences. His early treatment could have prevented months of suffering and emergency surgery. If your back pain fits the second profile, the message is crystal clear. Don't ignore it. The action plan. Document everything. Keep track of when pain occurs, what makes it better or worse, and any other symptoms. Seek immediate medical attention if you have severe abdominal pain with back pain, especially with vomiting or fever. Ask for the right tests. Specifically request lipase and amylase levels, plus imaging if indicated. Don't delay. Acute pancreatitis can be life-threatening and requires immediate hospital treatment. It's crucial to emphasize, this content is for education, not medical advice. If you identify with these symptoms, the most important step is seeing a doctor, preferably a gastroenterologist. 7. What to do now? The path to diagnosis and treatment. Emergency treatment. Acute pancreatitis is a medical emergency requiring immediate hospital care. Treatment typically includes NPO, nothing by mouth, to let the pancreas rest, IV fluids for hydration, strong pain medications. Investigation of the underlying cause. If gallstones are the culprit, you might need surgery to remove them once the acute episode resolves. Chronic management. For chronic pancreatitis, treatment is lifelong and focuses on pain control, low-fat diet, crucial pancreatic enzyme supplements to aid digestion, complete cessation of alcohol and smoking. Mark from California was diagnosed with chronic pancreatitis at 45. By Will, strictly following his treatment plan, taking enzymes with every meal, avoiding alcohol completely and working with a nutritionist, he's maintained his weight and lives an active life 5 years later. Cancer concerns. If cancer is suspected, imaging tests like CT scans and MRIs are essential. Treatment depends on the stage, but may include surgery, chemotherapy, and radiation therapy. While pancreatic cancer is serious, catching it early dramatically improves outcomes. Some patients diagnosed in early stages have survived 10+ years with proper treatment. Section 8. The bigger picture. Your body's communication system. Here's what I want you to take away from all this. Your body has an incredible way of communicating when something's wrong. A back pain might just be back pain. But sometimes it's so much more. It's a message about a deeper problem that needs your immediate attention. Learning to listen to and interpret these signals is one of the most powerful things you can do for your health. You know your body better than anyone else. Trust your instincts when something feels different. Don't underestimate pain that's unusual and doesn't go away, especially when it comes with other symptoms. That discomfort you're blaming on poor posture might be your only chance to diagnose and treat a serious pancreatic condition before it's too late. According to the American Cancer Society, early detection of pancreatic issues can improve survival rates by up to 300%. Your awareness could literally save your life. The key is education and action. Know the warning signs, trust your instincts, and never hesitate to seek medical attention when something doesn't feel right. Your body is constantly talking to you. The question is, are you listening? A back pain might just be back pain, but sometimes it's a crucial message about something much deeper that deserves your immediate attention. Don't ignore pain that's different and persistent, especially when it comes with other warning signs. That ache you're attributing to bad posture could be your only opportunity to catch and treat a serious pancreatic condition while there's still time to make a real difference. Take care of yourself, stay informed, and when in doubt, always consult with a healthcare professional. Your future self will thank you for paying attention today. If this video opened your eyes to something you never considered before, do me a favor, share it with your friends and family. Send it to someone who's been complaining about back pain. You might just help them connect the dots and find the answer they've been searching for. Sometimes sharing the right information at the right time can literally save a life. And don't forget to subscribe for more content that could protect your health and the health of the people you love. I'll see you in the next video.